not saying that right now everybody accepts having a mental health diagnosis. There's still stigma. There's still plenty of stigma. There's lots of people feeling like if I get diagnosed with any kind of mental health condition, even an anxiety disorder or a depression, that people are going to think I'm crazy, that someone's going to lock me up. And if we work in healthcare and if we work in mental health, we certainly know that that's not true. But these days, it's much more commonplace for all of us who are younger, who baby boomers and younger, to talk about mental health in a more casual way. And how might that be seen? How do you see that change, that shift has happened with us in our culture?
Like a lot of celebrities are now.
Yeah, great example. Celebrities are now out of the closet. And a couple of older adults who maybe some of you might not even necessarily think about as older adults, but for all intents and purposes, over 60 is considered to be an older adult, not necessarily a senior, but an older adult. John Cougar Mellencamp, now known as John Mellencamp, has very publicly talked about struggling with an anxiety disorder during his entire career and still struggles with it. Howard Stern, for example, the radio announcer, publicly talks about his battles with OCD. Howie Mandel, a little bit younger, but he talks about his struggles with anxiety disorders. And so you're absolutely right. When celebrities and persons that we admire or that are in the public eye or who have had tremendous accomplishment discuss the fact that they've struggled with anxiety disorders, it can become a little bit more palatable for someone to say, okay, maybe I have some of those symptoms as well. Any other reason in our culture it's been a little bit more acceptable? Yeah.
I have a client that is accepting of it because of an adult child.
An adult child has an anxiety problem. And so the client sees it in the son or daughter and realizes that he or she also has it?
Yes.
Wow. That's a very powerful example because so often the person does not realize, the older person does not realize that they struggle with those symptoms until they see an adult child going through that. And I think we see that a lot also with people, say, in their 30s, 40s, even younger adults when they have small children. Because anxiety disorders are very much believed to run in families. There is definitely a belief that there's a genetic or biological component as well as environmental. Any other reason that you think it might be more acceptable nowadays to talk about this?
Well, I'm thinking that there are physicians, especially the younger adult, but maybe there's more talk about how you feel and everything, etc. But whether being asked about
Yeah, there's a lot more, great example. Doctors have a lot more health education. A lot more continuing medical education is done around mental health and mental health concerns. And I believe even the most scientist doctor or research-oriented doctor can't ignore the fact that having a mental health concern, especially an anxiety disorder, can truly wreak havoc on your physical health. And so many general practitioners, many primary care physicians have really embraced mental health screening because they know that it really can impact physical health if people don't get proper treatment. Yes?
Another thing is that a lot of times you find that with not just older adults, but maybe more so, that the anxiety is expressed as a somatic complaint.
Absolutely. Great example. That a lot of doctors and a lot of healthcare providers find that the anxiety is manifesting in a somatic complaint, and what might be some symptoms that surface like that? Headaches is a big one. Stomach problems, GI problems, that's a really common one. And a lot of people who aren't dealing with their anxiety disorder, that's where it comes out. It comes out physically. Yes?
Television is selling all these drugs.
Thank you. Yeah. You know, there's a lot of us in healthcare that feel that those pharmaceutical companies should not be directly marketing to the consumer. That we turn on our television, we constantly see medicines being advertised on television. And, I mean, I think if you are somebody nowadays that takes a medicine, you're the bravest person in the world after they read all of those side effects that you're likely to encounter. I mean, gosh, no one wants to even take an aspirin. But in all seriousness, it does normalize it. And so at least if you hear some of these symptoms that you're struggling with on a commercial, you might think twice and say, you know, maybe I'll ask my doctor about it. Maybe I'll mention that I have these symptoms. I don't know that it's a great thing for somebody to go into their doctor's office and say, oh, I need the one with the butterflies, or I need the one with the wind-up doll. But that they know that there's, and not everybody who has an anxiety disorder needs medication, but that they know that, hey, this is something maybe I should talk to my doctor about this issue. Great example. Thank you very much.